Felton family. My name is Marta Alvarez, and I serve at Felton Family Development Center as mental health specialist. Today I'm here to share with you some mental health tips during this time of shelter in place. Prior to sharing with you the mental health tips, I want to first recognize the roller coaster of emotions you may have experienced when sheltering in place was first announced in San Francisco. One had only to step into the supermarket to feel an energy in the room that would trigger a chain reaction in even the calmest of persons that had heard of the news. What we experienced in the supermarkets were people making panic purchases to make sure that their basic needs would be covered during a time of an emergency. There was a lot of uncertainty as to what this COVID-19 was, is, and is becoming. This produced a lot of thoughts of what if. What if the supermarkets would close? What if the banks would not remain open? What if there would be no one to run the gas stations and allow for us to be kept mobile? Whatever it is that you felt was very real and very valid, and you were not alone because it was shared by many people. Our government has asked us to stay home in order to impede or stop the spread of COVID-19. That being said, I want to pose a question to you as a parent or an individual. What is your game plan? What is your game plan during a time of an emergency? In this state of an emergency, our health is of importance. So, considering our immune system, which keeps our bodies healthy, would be good to incorporate in our game plan. There are many factors that can strengthen our immune system as well as weaken it. Stress is one of those factors that would weaken our immune system. This is why I'm going to share with you today some mental health tips to help reduce stress. The first mental health tip I'd like to share with you is to make certain that we're getting the 7 to 9 hours that our bodies require. When we wake up well rested, we're better able to manage the micro stressors of life, such as losing our key and having to find it, having to stop our children from fighting over a toy, or having to deal with technology we don't quite know how to operate. When we feel well rested, we'll be able to manage those micro stressors of life in a much calmer way. The second mental health tip I'd like to share with you is to try to incorporate exercise into your daily or weekly routine. There's a direct mind and body connection, and when our bodies are in a state of moderate to vigorous exercise, it permits for our brain to send out neurotransmitters such as the feel-good neurotransmitter of dopamine or the pain-reducing neurotransmitter of endorphin. It produces what is known as a runner's high, which can feel in our minds as a more clear state of mind, which also produces more optimistic thought or view, which can help us when we have to make choices such as having to find a new job or having to pay our bills. Exercise is recommended for people that have anxiety or depression and overall just for general good health. I highly recommend it. The third one that I want to share with you is to meditate or simply to reflect on those things which are positive, just, or of a good report. When we purposely reflect or put our thoughts on that which is working in our lives, that will help to have our emotions also be more positive because the mind and the emotions have a direct connection. And when our thoughts are positive, our emotions will be too. And our thoughts and emotions have a direct linkage to our behavior, which can help us in the way that we relate with others because it might put us in a more optimistic or happier state of mind. I'm Marta Alvarez with the Early Intervention Team, wishing you and your family fit mental health.